Welcome back to Champions of Care, brought to you by Oakwood Healthcare. Today, we're talking about sleep disorders, and one of the most prevalent and common sleep disorders is sleep apnea. We have a specialist in the studio I'd like you to meet. It's Dr. Lyle Victor. Welcome, Dr. Victor.
Glad to be here. Hi.
You're a pulmonologist and sleep specialist with offices in Riverview, Canton, and Dearborn. Is that right?
Yes.
Now tell me, what exactly is sleep apnea?
Sleep apnea is a disorder that only occurs when you're sleeping, and it is intermittent obstruction of the upper airway while you're sleeping, associated with snoring most often, and associated with a brief arousal each time you snore and snort. And then the next morning, you don't feel so hot.
So I'm tired the next morning. It is
tired, fatigue is those are the two symptoms most commonly seen with sleep apnea. Some people are sleepy, but the most common complaint is I'm tired.
What causes it? I mean, what's a normal passageway and what's a sleep apnea passageway? Well, I know we have a video or a slide here to show folks.
Well, the anatomic reason for snoring and sleep apnea is seen in the upper airway. This is a normal person, upright position, and here's the tongue, and here's the voice box down here, and then the uvula, the little thing that hangs down when you open your mouth in front of a mirror. And this is your airway, your space right behind the tongue. Usually it's about 4 cubic inches in size. And the next slide will show an overweight person lying down flat. And it turns out that people with sleep apnea have a large tongue, and the soft palate and the uvula, the thing hanging down, may get swollen and big. And so the airway is smaller. And because the airway is smaller, you're trying to breathe air into this airway, and you get vibration. That's snoring.
Does this condition only happen with overweight people?
No, it can happen with people that are normal weight. About a third of people have a problem with their jaw. And that's a very good question, because not everybody that has sleep apnea is overweight. They may have a receding jaw.
Can I look in the medicine chest mirror and tell if things are normal in there?
Well, here's a normal throat. This happens to be my throat. And you can see the posterior airway. There's about 4 cubic inches back there. Here's a uvula, relatively normal in size. This is a slide of somebody that has pretty significant apnea. Not overweight. This was just an adult. He was in his 30s, and the first thing you notice, the uvula, the thing that's hanging down, is much larger than the uvula in the preceding picture, and it's swollen. And then here's some large tonsils. Now, admittedly, this is a particularly bad airway, but this is somebody who is snoring and obstructing all night long. Had to have a tonsillectomy and removal of the uvula.
Now, you talked about some of those symptoms and some of the things I'd experienced, but if this is a spouse, how do I really know what I'm hearing or suspecting is sleep apnea? What does it really sound like?
Well, I'll show you. You'll look over at your spouse. This could be a man or a woman, and maybe they're sleeping on their back and they're doing something like this. They snore, they obstruct, they struggle to breathe, they wake up. And they'll oscillate or just do this all night long. It can do it up to 100 times an hour.
So I've heard people say they stop breathing, but I mean, most of us are thinking, well, if my spouse stopped breathing, I'd be calling 911. So it's just that little, short break.
And another important part of that is that you may not stop breathing entirely. So some people that have very bad apnea do something like this. And so the tongue is partially obstructing, the airway is partially obstructing. They wake up just the same and feel crummy the next day. So they may not be making a lot of noise, but that partial obstruction. Really, when you're sleeping, ideally, you should be sleeping like this. You hear nothing.
Now, what happens if this goes untreated? Is it anything more serious than I'm just tired the next day?
Well, usually, as time progresses, people will become fatigued. They'll get tired, they'll get sleepy, but worse, they can have strokes in the middle of the night, stroke in the morning, they can have heart attacks, high blood pressure. So, typical patient in the sleep center, male, middle-aged, overweight, hypertensive, snoring.
You know, the Oakwood Champions of Care video team took a tour of the Sleep Study Center. Let's take a look at what they saw.
Thanks, Mary. I'm here with Shelton Sherman at the Oakwood Sleep Apnea Center in Riverview, Michigan. So Shelton, tell me what needs to happen if somebody's getting a sleep study performed.
Well, typically, patients can be referred by several doctors, dentists, nurse practitioners, physician's assistants. Any licensed clinician can order a sleep study.
And why would someone order a sleep study? What are some of the signs and symptoms that a patient would show?
Typically, if a spouse notices that a patient is stopping breathing during the night, where they're a snorer, there will be intervals where a patient will snore and then stop snoring, then start snoring again with a gasp. That's usually a good indication to a spouse that their loved one probably needs a sleep study.
Okay, so once the patient comes in for a sleep study, what happens?
Well, once the patient comes in, we'll have the patient fill out their paperwork, escort them to their room, and we'll start the hookup process.
Okay. And what do you do when you hook up the wires and the leads to the patient? What are you looking for?
Well, the leads are very specific to the region where they're recording the information from. For instance, a eye lead we would apply to measure for eye movement throughout the night. That helps us to determine REM, which is rapid eye movement sleep. If an electrode is by chin, we're picking up muscle movements in the face. Okay. We'll also be picking up heart activity, so we'll be applying EKG leads, respiratory belts, and EMGs on the leg, also for restless leg syndrome.
Do they go to sleep with all of the monitors and leads on?
Yes. Once all the wires are applied, we kind of put the wires into a ponytail, in a secure ponytail, where the patient will have ample room to change positions in bed. They wouldn't have to worry about an electrode coming off. Once the test is concluded, we do formalize a report, which would have a complete update of the patient's oxygen changes, the patient's stage changes of sleep. If there were cardiac arrhythmias throughout the night, it will give a complete report of every electrode we've monitored.
Well, thank you so much, Shelton, for taking the time to talk with us today.
Okay.
Back to you, Mary.
Dr. Victor, once you know someone has sleep apnea from a sleep study or other means, what do you prescribe?
Well, the most common prescription is Cpap Mask, and it stands for continuous positive airway pressure. And basically, it's just a fan that blows air into a tube and then into your nose and throat and keeps your throat open. If you want to know what it feels like, open the window of your car, drive 15 miles an hour, put your head out the window and open your mouth. That's what it feels like.
So it's a fan? Is it loud?
No, it's not as loud as a snoring.
So is it hard to sleep with that thing on?
If you're sleepy enough, you'll fall asleep, and most people like it. Some people don't, but 90% of the people will wear the mask because they feel so much better the next day.
For those who don't like it, are there some alternatives?
There is, and that's a dental appliance. So if the apnea is not severe, if it's mild to moderate, you can get a dental appliance, and basically it's two plates, almost like a denture, and this particular model has two flanges, and what it does is it moves the lower jaw forward and pulls the tongue forward so that you don't snore.
Does that hurt to wear that?
Not usually. Some people rarely will have some pain in their jaw afterwards, but that's uncommon. So most people can wear this. The issue with the dental appliance, two issues. One is it depends upon what the insurance companies pay, so sometimes that drives whether people will get one.
Because that's a dental device.
It's a dental device.
This is a medical device.
That's correct. But more medical insurance companies now are paying for this because it's a device for a medical problem. So it's not a dental problem, it's a medical problem. The other perhaps potential problem with it is it doesn't work as well as a mask.
Now, for those people who might be thinking they don't want to wear that mask, we spoke with one of your patients and his wife about his treatment, and we have his video story to tell. Let's take a look.
My symptoms were a lot of waking up at night. I'd notice I'd wake up, I'd look at the clock, go back to sleep, but I was doing that more often. And I also felt a little more tired during the day. I was getting enough sleep. I thought, going to bed regular time, but I still was feeling a little drowsy.
The snoring had gotten a lot worse, and there were long pauses in between the snoring. So it would get very silent, and then all of a sudden he would gasp and snort and choke and take big giant breaths.
I knew I snored, and that was getting worse. And that was one of the things that concerned me.
I don't think it really disturbed him very much, but it was very annoying to me.
I did get some knees and some elbows to wake up because, well, first off, to get me to start breathing again. I think that was more than the snoring, to make sure I was breathing.
And to turn over, because it wasn't as bad if you were sleeping on your stomach.
Correct.
So on your back, it was really terrible.
My family doctor recommended the sleep study. After they check other things, if you're on medication, things like that, that could affect you and things. The doctor that was working with me for my sleep study was Dr. Victor. And they basically try to get you to be tired when you come in, especially a day study. It's a little tougher. So I kind of stayed up a little more that night, so I was a little more tired so I could actually fall asleep, which is what they need you to do. And it was pretty obvious I had sleep apnea with my sessions of stop breathing. That's the main thing you got to worry about. Of course, I worried about the most. I didn't care about my snoring as much, but the stop breathing bothered me a lot. So I basically sleep with my mouth closed. So I had a mask that just covered my nose. If you happen to breathe through your mouth, you need a full face mask, which covers the nose and the mouth. They also have ones just like nasal cannulas that just stick in your nose. Depending on what works for you, you have to kind of go through some masks to figure out what you like the best. It took me probably 2 weeks to get comfortable with it. And after that, though, now it's just second nature. I've noticed my whole health and my sleep patterns much better. Being tired is strictly if I just don't get to bed on time, but other than that, it's working great.
I'm not as tired. I don't have a kink in my neck from sleeping on the couch anymore. It's a marriage saver.
The Oakwood Sleep Center was top-notch in my book. They've been around a long time. They have multiple locations. The staff is well-trained. I had no problem with any of them. Make you feel very comfortable, because it's a kind of scary situation when you're trying mask and they're trying to sleep and they're filming you and things like that, but they made you very much at ease, so it was a great experience.
Dr. Victor, we've talked a lot about adults with sleep disorders. What about children? Is it different with children?
Well, sleep apnea manifests itself differently in kids because instead of becoming sleepy, they become hyperactive. And I think the best description is when your child is not getting enough sleep or is ready for bed, what do? They don't say, "Mommy, I'm sleepy." They start jumping up and down and running all over the house. They're hyperactive. That happens in kids. So school problems, hyperactivity in school, ADD diagnosis in school. Not every kid with ADD has sleep apnea, but a sizable percentage will, 20%, maybe more, and treat the sleep apnea and the school problems are alleviated.
Well, Dr. Victor, I really want to thank you for being here today, teaching us about sleep disorders in general, and also this growing area of sleep apnea. Thank you so much.
Thank you.
Dr. Lyle Victor is taking patients. You can find out all about him and get his phone number by visiting his page on oakwood.org. We've been talking about sleep disorders today. I want to thank Dr. Lyle Victor, Dr. Sheila Ray, and Dr. Vijay Khanna, our experts on the subject. You can find out more about sleep disorders at oakwood.org or call us at 1-800-543-WELL. Until next time, be well.